But we'll do something, right? We'll meet up for something. Okay, all right, wrapping up things, go through a little bit more therapeutic techniques that we use in behavioral therapy, and then we'll have group 4 come up here and present. All right, so next we got aversion therapy. So our previous class we talked about different therapeutic techniques that we use with our client based on their issue. One of the prominent ones that are used is aversion therapy. Particularly this is used for alcoholism, other substance abuse issues, sexual deviancy, things of that nature. So aversion techniques essentially are trying to make a stimulus aversive by using other stimuli or components or methods to make something sort of repellent or disgusting, if you want, if you will, so that the behavior or the stimulus for that particular behavior or object does not take hold. So it's an intervention technique used to treat behavioral excesses such as drug addiction, right, alcoholism, and sexual deviations. So in essence, if you think if one has sexual deviations, let's say it could either be towards children, it could be things that are clearly, harmful to others, illegal, what have you, or even something just personal and problematic to the individual themselves because of ideations, right? We could try to present some sort of redirection, right? Redirection of being impulsively stimulated by something, by creating something in the mind that is abhorrent to that thing, right? So we want to create an adversive stimulus, right? Unconditioned stimulus. Conditioned stimulus is presented that competes with the inappropriate stimulus to inhibit the undesired response. So we have to create a competing response to the stimulus so that it takes hold of the former stimulus and now a new behavior or impression of that thing takes shape. Operant escape and avoidance responses are also developed to negatively reinforce desired behaviors. The treatment of behavioral excesses using aversive stimulus is complex, very complex, because you think of, well, what are some creative techniques you could think of as a person really loves a substance, really loves some sort of drug, really loves alcohol, right? Really maybe even addicted to, say, pornography, right? Maybe you have some other ideations of sexual deviancy. What could be some creative means? Let's start with just drugs. How could you make drugs repulsive to someone, right? Who loves drugs? How could you make a particular food repulsive to someone who truly enjoys that food? What are some of the things you could come up with? Yes?
You could try like pairing it with a negative stimulus.
Such as what? Give me an example for, say, a drug or food.
So for food, I mean like if when they were going to eat this specific food, if they take like a certain pill that like causes nausea.
Yeah. Right, so you think of, you can make that item
No longer desirable.
Yeah, you make it undesirable. Right, it's kind of like if you got food poisoning. You ate your favorite tacos at your favorite taco joint or a random taco joint, and you get food poisoning. You threw up for a couple days, diarrhea, etc. And now you're in your mind, you're gonna avoid tacos for a while because you are in the belief that tacos will inevitably make you feel sick, right? But here we say it can't be a one-off. This is something we have to present in different ways. So maybe you use, well, maybe not just noxious to a degree, you also make it taste different as well too. So maybe you could mix tacos with something really sort of nasty. And now you're eating tacos, you're like, you know what? I no longer enjoy tacos. It just tastes different, right? Tacos no longer taste like they taste. You can change ingredients, the degree of things, the seasoning, the spice, all sorts of things to change one's perception of what tacos taste like. It's inevitably like if they change the ingredients to Doritos. Like, okay, everybody loves Doritos for the most part. And now if you've modified what Doritos taste like in your mind, you're like, you know what, Doritos just don't taste the same like they did 20 years ago. And now you say, no, I want some, we go against Doritos, I'll try something else. Yes?
Kind of in that same vein, actually, like I had, this is a while ago, I had went on like a health kick and I stopped drinking soft drinks and like chips like Doritos and Cheetos
Yeah.
and the like. And I did that for like a year and a half, and then I finally was like, oh, I'll try this again. And I can't drink soft drinks and I can't eat those chips anymore. Because the soft drinks are just too sweet and the chips just taste fake and empty.
Yeah.
And I just can't do it.
Yeah, I think we created a new normal, right? And we say, hey, a stimulus to something is an automatic process. Once again, we said anything automatic is what we would say natural, right? So we'd like, it's natural to you, maybe unnatural to others, but it's natural to you because it doesn't require any energy for you to do it. You automatically respond, right? No conscious effort there. So now you've created a new normal for yourself, right? By switching it up and now trying to go back to a previous normal seems a bit unnatural. It's abnormal to you, right? Because your taste buds have a new frame of reference, and it's the one that you currently have. Mentally, even if you want to try, your taste buds are like, this doesn't do it, right? It did it before, it just doesn't do it anymore. So in essence, it could be viewed as some sort of growth in some way, and inevitably just some sort of change. And we're just trying to affect some sort of change, either physiologically or psychologically, right? So physiologically, taste buds, it tastes nasty, this is not the same, or mentally, it's just you can't bring yourself to do it anymore. The treatment of behavioral excess is using aversive stimuli is complex and requires not only knowledge of behavioral principles and procedures, but also supervised training and experience in a treatment setting. Not easy to do, right? Because if we like something, it's hard for us to get over mentally, like you just changed the ingredients, like, and I know that tacos still taste like tacos. So now I'm just gonna go where I know tacos still taste like tacos, right? Or you'll find yourself still impulsive to not include the aversive stimulus so that you can go back to feeling good with your normal stimulus for the thing. Aversive conditioning techniques are usually chosen as a last resort, right? Or for specific problems that are otherwise difficult to treat. During the past few decades, practitioners have used these techniques less frequently because of disadvantages, right? Which include higher costs, more discomfort, and greater intrusiveness. Very costly, right? To try to inhibit some sort of aversive stimulus to an individual, specifically if it's like alcohol or even high-priced drugs, right? Because now you have to use all sorts of experimentation, and those substances themselves cost a lot of money, but alcohol costs a lot of money to try to transfer a stimulus from one to the next. More discomfort. You are making people repulsive, right? And which inevitably can bring about some other psychiatric issues, right? Some other psychological discomfort, right? Now you may have put someone into depression because you've made something very, very repulsive, and now they view that thing constantly, and now they're just constantly walking around repulsed, and now they feel that they can't function. Greater intrusiveness. You do have to get very, very personal into people's lives, especially if we're talking about sexual deviancies, right? Which is a big issue. If you have to bring about family members, coworkers, people who may not have known you've had these ideations in your mind, very intrusive, very problematic socially, long-term effects, right? Stigma, long-lasting stigmatization on people, but obviously for the greater good, to divert people from committing heinous acts of sexual violence, heinous acts of violence against children, what have you. All right, so we say stimuli, aversive stimuli such as electric shock, right? We say, hey, we want to make something repulsive, adversive, right? So we say in some practices we may use electric shock. You try to reach for something, that particular thing that you're interested in, we put you in a control setting, we shock you, right? So now there's pain, the idea of pain being associated with that particular stimulus, right? And so that itself could be harmful. Noxious odors, we say if you smell them all the time in other places, now you can't even be in those environments anymore. You say, hey, I gotta get out of here. You're like, what's wrong with that person? Well, I tried to transfer one behavior to the next. Unfortunately, these common odors that I smell now make me want to throw up, and I just can't be in the setting. Right now, well, you're like, well, it's a setting where we all gathered here for our family. Well, I just can't handle it. I gotta get out of here. Could lead to issues. Or nausea-inducing drugs or emetics, as we call them, to treat excesses such as cocaine abuse, alcoholism, smoking, and other sexual deviations. Many situations, however, it's inappropriate or inconvenient for practitioners to actual versus stimuli such as shock. You know, there's protocols that we have to stand by, and in many sort of areas, it's illegal to use shock therapy for reversion therapy, right? But there are some areas where you still can get that sort of treatment. Several covert conditioning techniques, such as covert sensitization and thought stopping, were developed to treat behavioral excesses based on research findings. So you think of thought stopping, right? Things that create, let's say here, sexual deviations. How does one go about trying to be conscious enough to stop their thoughts about something, right? Very, very, very difficult. You're telling someone to stop their thoughts. We know that in itself can cause anxiety, right? And that in itself can make you actually focus more on the thoughts. And now you have to try to practice some sort of escapism from that sort of anxiety, in which case it can make their behavior even worse, right? All right, and using aversion therapy to treat an individual who has molested children. The picture of a naked child, right, the conditioned stimulus, elicits sexual arousal, the unconditioned response. Treatment consists of pairing a picture of an aversive stimulus such as noxious odor until the picture elicits nausea. So the very visual aspect of viewing some sort of sexual deviant stimulating behavior. Here we're talking about children. We want to make the very perception of very noxious or vomiting sort of experience with viewing pleasure, right? We're not with that, right? The client removes the noxious odor, right, by performing an escape response, such as turning away from the picture of the child. So you say, well, how do I get rid of this sensation of being nauseous by viewing this? I simply look away, right? And now we want to say, whenever even immediately presented with something that would have originally created a response, we immediately turn away from it because we have a sensation that we're going to have some sort of aversive sort of effect by viewing it, right? It's going to be harmful for us mentally and maybe physiologically. physiologically to view such things, right? This is also used, for things like people who even engage in like pornographic materials, things like that. Even the idea of viewing it, we could get them to a place to where, it feels very unpleasant. And so there's an immediate redirection to not view it. All right, the client could also perform an avoidance response that prevents the onset of the aversive stimulus, right? Therapist specifies an appropriate avoidance response the client can make, such as turning from the picture of the child to a picture of an adult female, right? So now we say we are sort of redirecting, right? We're redirecting to say unpleasant to pleasant. So we want to get them to a point to where they're viewing maybe a child as an unpleasant activity, but saying to get to a pleasant mental space, we direct it to an adult female, right? Step by step. And so we've made it sort of no longer sexual deviancies because we're talking about children. We made it maybe more of a natural phenomenon to where we're talking about adults viewing adults, right? Get to that point. The conditioned stimulus of the naked child also function as the stimulating sort of stimulus and response for the avoidance response, turning to the woman's picture, which is negatively reinforced by the prevention of an onset of a foul odor. Right, in this way, we can say even if it's another sexual deviancy, say someone who, sexual aggression or sexual violence towards adult women, right, we sort of can do the onset of a foul odor as a stimulus. In this way, the client learns to increase the performance of appropriate responses that are incompatible with the undesired behavior. All right, next we get cognitive behavioral techniques, right? All right, cognitions are covert behaviors that refer to private, unobservable events, including thoughts, beliefs, and attitudes, right? So we say we're dealing how thoughts create feelings, how feelings create attitudes, right? And beliefs, and how those take effect. Emotions, feelings, and physiological responses are also covert behaviors that are influenced by cognition. For example, if you believe a trip to the dentist will be painful, it can result in your feeling anxious when making the appointment, which means you will exhibit avoidant behavior. You will not make the appointment to the dentist, and thus you will have issues with your teeth because of your belief and your perceptions are influencing your attitude, your emotions, right? And we want to change those thoughts that create that. Alternatively, believe that a trip to the dentist will make your teeth clean and attractive. It can evoke a pleasant response. So we want to sort of create some sort of positive effect by thoughts. This is using positive psychology, which is really just focusing on positive attributes about a phenomenon, person, place, thing, or an event, as opposed to a negative. Cognitions and emotions are important to behavioral practitioners because clients frequently seek help for problems they define as primarily cognitive or emotional, such as, I think about failing out of school all the time, or I feel that I just don't have what it takes to get ahead of life. We think of these are just merely your definitions and perceptions about something. These are your thoughts, right? So CBT is extremely commonly used because I believe that it's the easiest form of changing the practice because your thoughts are where things originate, right? Your thinking. Who says it's so? Who says you'll fail out of school? You won't be successful in life? You're saying that, right? But why do you have this sort of belief? Well, you'll come up with all sorts of reasons and excuses, but they're probably don't present themselves or manifest in reality all the time, so you basically are inconsiderate with things that are positive and more obsessive and more compulsive to have ideas of things that are negative. You're essentially bracing yourself for the negative to happen. Then it makes you feel more relaxed to be in that things. They can be measured through self-reports, self-ratings, and biofeedback instruments that record physiological response such as muscle tension and relaxation. Alright, let's give group 4 a moment up to come up here and do their presentation, and we'll move forward from there.
Do we connect with ours?
No, I could just pull it up right now. Alright, we got procrastination with Valeria Naomi. Here's the, whether we move it up the slide.
So we decided to do procrastination just because it's a behavior that we both seem to want to change, and maybe some of you as well. So the definition would be the delay or postponement of tasks despite conflicting consequences. So this is usually done because of discomfort, to avoid discomfort or anxiety or the assumed difficulty of the tasks. And it often happens because of wanting things to be perfect or struggling to control oneself, whether that's like trying to limit yourself and knowing when to stop using your phone, and choosing to do what feels good right now instead of what's better in the long run. So these factors, they can quickly turn into a repeating cycle, and that is what is procrastination. So some common relatable examples of procrastination would be waiting until last minute to study for an exam or starting an assignment, putting off scheduling medical appointments, or postponing going to the gym, even though the intention to be more active is there.
Sorry, I'm a little sick. The hypothesis, so for procrastination, may be caused by a combination of psychological factors, including fear of failure, lack of self-discipline, and an imbalance in the brain's reward system. For example, so like why, for like self-regulation, choosing short-term rewards over long-term benefits. So choosing to watch television at the moment instead of doing your homework or making a call or certain things that has to get done in the moment. You prefer to just do something more enjoyable and something that would be more beneficial in the long run. And then anxiety, so the fear of result. So I know for me, for example, I hate making calls sometimes because I just get very nervous, so I just put it off instead. And then the feeling of overwhelm.
So we can replace procrastination with doing more productive behaviors. So creating a to-do list and prioritizing tasks, those kind of go hand in hand. So perhaps seeing it jotted down on paper will allow you to feel like a sense of urgency of what needs to be tackled first. Visualizing success can also be motivating, because then you'll know what success will look like and you'll want to get to that point. You can also eliminate distractions, so for example, phone time or TV time, and establishing a routine so that it becomes a norm to do these tasks every week.
So here's a plan. So step one would be breaking down the task to make it more manageable. So, making small enough to be handled. So for example, with assignments, maybe setting off a certain task to be done by a certain, time, or once it comes to like the due date. When you do these small tasks, you'll be satisfied, which would be almost like a reward. And then building habits, becoming more organized, and then having time management, and also as well limiting distractions. And then step three would be increased motivation, the reward system. And then positive reinforcement would be treating yourself to something enjoyable. And then positive punishment, for example, like rubber band.
Yeah, so like every time you catch yourself procrastinating or putting things off to the side, you can just like snap yourself with the rubber band. Same for positive reinforcement, so you can treat yourself to something you enjoy, whether that's like watching an extra episode of a TV show or like giving yourself an extra hour on your phone time.
Any questions about procrastination? Alright, who here procrastinates? Tell me your, what do you think the actual source of why you procrastinate? In the back, starting all the way in the back.
With me?
Hmm?
I think it's just like the energy, like I need to have the right amount of energy, like to devote mental energy or like thinking about something. Like sometimes I'm not ready to like sit down, start something like and follow through with it. But like if I have only 2 hours left until it's due or even less,
Mhm.
like I don't get the other option. So like I have to do it. It's gonna get done unless I have a random burst of energy where I feel like, okay, I wanna be productive, and then I'll get stuff like out of the way for future stuff.
Do you think it becomes a strategy for you to just operate that way? Like some
Probably.
people will be like, hey, you know what? I just put things off till last minute because I know when it has to finally get done, I'm gonna finally focus,
Mm-hmm.
and it'll be like have decent work. Whereas like if you had to spread it out and do it, like it'd be so casual that maybe you won't perform so well. Or do you think of you're like, hey, I procrastinate because it's just not important. Think about that. If something's important to you, won't you do it? If something's meaningful to you, wouldn't you want to do it? Right? Like if you want to go, you have a taste for hamburgers, you're like, hey, I'm gonna go grab me a hamburger and I'm gonna drive 2 miles down Harlem. You're gonna go because it's important to you, right? It makes meaning. You're like, that requires no motivation. That motivation is automatic to go eat some good food that I want to eat. But if it's like completing the work or finishing school or something else in life, do you find it be like, you know what? Somewhere in the recesses of my mind, I think it's important. But maybe in reality, it's not important because I don't do it. And I don't do it on time, right? So maybe it happens to be an actual conflict, maybe an internal conflict of us deeming long-term importance of something we're actually not too sure about, right? Let's say if it's homework. You could say, well, homework has to do with passing a test, which has to do with passing a course, which has to do with finishing school. Maybe there's an uncertainty about finishing school because you're like, really, I don't know if it pays off. I don't know, maybe it's a gamble. Therefore, the small, tiny details it takes to actually get to that final goal, you may drag on it because you still feel an internal conflict of like, I'm not sure if this matters, right? Remember, we only stimulated by what matters, right? In this class or any class you take, you literally do not pay attention unless something is actually matters to you, right? A certain term, something personal, familiar to you. Oh, that sounds interesting, right? 90% of stuff don't sound interesting, you can care less. That's for every class, right? So we say we naturally are each one of us, based on who we are at this point, we're stimulated by different things. And that stimulation creates motivation to do the stuff. Right? But if you're not stimulated, like, hey, I'm doing a topic on Ernest Hemingway, and although you're like, hey, I'm actually maybe interested in Ernest Hemingway, but not in a 10-page way. I don't like him that much. I like him just enough that I personally like him. Right? Now, someone else, professor, he's an external stimulus telling me I need to do this to get a reinforcement of a positive grade. Now I have to kind of force myself to say, let me create some motivation that wasn't there in order to get this task accomplished, because I have a long-term objective of finishing school, right? Therefore, we can say sometimes motivation is a bigger picture situation, right? It's something to think about.
It also helps that it's the very last class I need to get my English minor, it's done.
Yeah, so now you may feel a little bit more motivation. Procrastination is universal. We do it in all regards, so don't feel bad about it, just change it. Right, the thing is, we take notes, bless you. You say take notes, write it down. Why? What does taking notes do? What does writing it down do? Take a journal, take notes, write it somewhere, put it on the calendar. If you have a calendar, etc., post-it notes. What's the point? Yes.
It ties it to the real world instead of just making a mental thought you can shove away.
Yeah. You say, hey, it's just a thought, right? There's a difference between people who take action in the real world, which is real work, versus just a thought that's in your head. If it never comes out as real work, then it doesn't really mean that much, right? We say you go to work physically because eventually it has to have some sort of meaning in the real world. So it's important. If something is uninteresting to you, but you gotta get it done, I say the practice of writing it down is probably one of the easiest and best things to get it done, right? Even changing the behavior of something, if we have a compulsion for something or a habit, writing down how to get rid of it at least makes it conscious, right? And we say consciousness requires effort, mental effort. If it's automatic feelings or thoughts and we don't actually bring it to consciousness and think about it, we're still engaging in non-effort requiring, non-energy requiring behavior, which is pleasant. It's very pleasant to not exude any energy, just laying in bed, right? But to actually think on something deeply requires a lot of mental energy. And what you find is that motivation starts to spark. You know, once you bring things to the conscious awareness and you actually start to think about it from different angles, it brings some sort of motivation that sparks out of nowhere, probably from the subconscious, to make us view things in a different light to change the behavior on our own. Procrastination. Who else is procrastinating and why? Why are you procrastinating and what about Will?
I think it's the fear of failure. I think I generally, in my head, I'm like, I'm never gonna be good enough, so I don't put forth the effort if I'm never gonna be I'm a perfectionist, so I'm like, I have to do 100%, but I never do 100%, so then I don't start.
Yeah, and so we say, hey, once again, that goes back to cognitive behavioral therapy. We say, one's thoughts create a belief. Your thoughts create an actual belief that failure is inevitable. And you actually have a belief that perfection is a real thing, right? There's no such thing. It's a perception. There's nothing we could define as something being perfect, right? Yeah, we say it is. It sounds really great. It sounds awesome. But if one were to think about that a little bit deeply, get a little bit more philosophical, we say no such thing as perfection. All it is do your best at that time with that information. You are no perfect person. You're gonna be smarter 10 years from now. So what you do to now is still limited by the time and the information that you have. But your perception is like, no, I have all the perfect knowledge right then and there, and I should do my best. That is a logical fallacy within it. So, and we say it leads to certain behaviors. Okay, all right, I'll check on the schedule for final speech so we can kind of figure out what next week look like. But we'll take this back up, behavioral techniques, on Wednesday.